Hey, I'm Vic Senese. Welcome to UroNurse News. Today we're reviewing a landmark randomized clinical trial comparing office-based laser coagulation to the gold standard of TUR-BT for recurrent TA low-grade bladder tumors. So, TA low-grade bladder tumors make up about 45% of all new bladder cancer cases. They're known for a high recurrence rate, but fortunately low progression risk. However, the traditional treatment TUR-BT under general anesthesia is costly, burdensome, and resource intensive. So the question is, can a less invasive office-based treatment match TUR-BT in short-term outcomes? That's what researchers in Denmark set out to determine in a prospective randomized non-inferiority trial conducted between 2016 and 2022. So here's how the trial worked. 300 consecutive patients with recurrent TA low-grade bladder tumors were randomized into two groups. Group 1, laser coagulation. Group 2, the TUR-BT. Group 1 underwent in-office laser photocoagulation using a 980 nanometer laser under local anesthesia. Group 2 received standard TUR-BT under general anesthesia in the operating room. The primary outcome was 12-month recurrence-free survival with a non-inferiority margin of 15%. Now let's look at the results. At 12 months, RFS after laser coagulation was 43.5%. RFS after TUR-BT was 43%. That's only a 0.5% difference, which met the non-inferiority criterion. Now this is key. Office-based coagulation was shown to be non-inferior to TUR-BT in recurrence-free survival at 12 months. Long-term follow-up with a median of nearly 48 months also showed no significant difference between the two groups. And importantly, only one case of stage progression was observed in each group. That means in terms of safety and oncologic outcomes, office-based laser coagulation appears comparable to TUR-BT, at least for recurrent TA low-grade tumors. So what does this mean for clinical practice? For selected patients, office-based laser coagulation could reduce the burden on both patients and the healthcare system. No general anesthesia, no operating room time, potentially faster recovery, more efficient follow-up care. And no patient wants to go to the OR. They'd much rather have something done in the office. Now, it's important to remember this study focused on recurrent TA low-grade tumors, not high-risk disease. But for the right patient, this trial suggests a real shift in how we manage low-risk bladder cancer. Well, that wraps it up for today's UroNurse News and Clinical Update. Tonight, on Dr. Jeff Talks About Sex and Intimacy, Unlocking Orgasm, the Pelvic Floor Connection, join guest host Dr. Susan Kellogg-Spate and pelvic expert Kelly Keene, physical therapist, as they explore how pelvic floor muscles shape orgasm, pleasure, and sexual satisfaction. You want to increase your pleasure and sexual satisfaction? Don't miss this episode tonight. Hey, tomorrow on UroNurse, did you know being a grandparent may actually protect your brain? From sharper memory to better mood and healthier aging, the science behind grandparenting is surprisingly powerful. Join me as we break down why time with your grandkids isn't just good for your heart, it's great for your brain. I like to spend time with my grandkids, and I got 10 of them.
Every weekday morning, set your clocks just right. 9 a.m. Central for some urology insight.